Hello, and welcome to the Secours Richmond Community Awareness Series. Tonight, we're going to be talking about something a little twist in neuroscience, and we're actually going to be talking about brain tumors and actually focusing on a little bit on cancer. And we're going to show you a little bit about brain tumors and how that actually links to neuroscience. You know, one of the things that we want to do in our show always is to talk about risk factors, but we always want to start with kind of a healthy twist of what you can do. And so tonight, again, as we focus on neuroscience and a different twist in cancer, I want to talk a little bit about, give you some good health tips overall in reference to cancer. One of the things that we're going to talk about is taking control of your health and reducing your cancer risk. So the one component that we'll always say is to stay away from tobacco, stay at a healthy weight, make sure you're getting those regular exercise program in and having a good nutritious diet, eating health and plenty of water. We're going to limit the alcohol, and then, don't forget to protect your skin. Now, I have a very special guest with me tonight, and I'm very excited to have Dr. Sherry Fox with me. Dr. Sherry Fox is a true colleague of mine in nursing, and I'm very honored to be here. Let me tell you a little bit about Dr. Fox. She's the Vice President of Secours Cancer Institute and the director of the Colorther Brain Tumor Quality of Life Center. And so that's where you're going to really hear tonight how neuroscience and oncology actually blend. She has been with the Secours system since August of 2006. Her nursing education was at Virginia Commonwealth University, and that's where she got her bachelor's, her master's, and her PhD. So she's a Go Rams person, I would say.
Go Rams.
Dr. Fox has held many positions in her 36-year career, including as a staff nurse, a nurse clinical educator, and you'll know that tonight because she's going to give you some educational tips. She's been a manager. She's also been a clinical nurse specialist. So she's run the gamut of what we've done all in nursing. Now, prior to her appointment as the director of the Colorther Center, and we're certainly going to talk about that tonight, she was the assistant professor at the University of Virginia. Dr. Fox's scholarly work includes publications of over 20 peer-reviewed papers covering neuroscience, cancer, and the quality of life in cancer patients. And she's done several presentations for over 40 peer-reviewed abstracts. Dr. Fox has had several national offices, including the Board of Directors of the Society of Neuro-Oncology, and also she's worked with the Therapy Oncology Brain Committee. Locally, Dr. Fox volunteers her time for the Legal Information Network for Cancer. She most recently was inducted to the American Academy of Nursing as a fellow. That's like the Grammys for nursing. And she it's a very distinct honor, and that only 1% of all nurses nationally ever receive that. Finally, she is the recent recipient of the American Cancer Society's National Lane Adams Quality of Life Award for the care of patients with cancer. So I certainly welcome Dr. Fox here with me tonight, and she is an expert. So callers, you need to make sure you call in and get this expert, 1% nationally of nursing in this field. And so she's going to be here with us to talk about that. So before we go on, I really want to talk to Dr. Fox about a lot of things. One, and you've been watching me for the last couple of weeks, I'm a true neuro girl, and I know that Dr. Fox is neuro at heart. She was also the president and the national president of the American Association of Neuroscience Nurses. So I first want to talk about, how did you get into nursing? Because I think one of the things we want to do is community awareness, is to talk about the different careers in health field today, and why nursing is such a good field. And then you branched off in various ways. So what got you into that?
Well, first of all, I want to say thank you so much, Pat, for having me tonight and giving me this honor to talk with you and share my wonderful experiences in neuroscience and oncology and nursing. It's been a blessing, and so I'm very, very grateful for the opportunity. People often ask me how I got off into nursing, and I had several extended family members, cousins, who were nurses, and I admired what they did, and my parents raised me to be a servant leader. They weren't healthcare professionals, but they were servants in their own right in their community, and so nursing was a perfect match to that. And that's sort of how I got started. Was I had female nursing cousins who I looked up to and admired and spent a lot of time with, and that's kind of what launched me into nursing itself. I also, as a young woman, young adolescent, I worked at the local hospital as a nursing assistant. Because in a rural community, and with the work ethic that my parents raised me with, I needed a job, and I was fortunate to land a job as a nursing assistant all those many years ago, which has been a long time.
Oh, wow.
And I just had these incredible mentors who worked in the local community hospital, and I grew from there.
Wow. Well, that's great. Are you originally from here?
I am originally from southwestern Virginia.
Okay.
Out near Hokie Country, Blacksburg.
Okay.
About 30 miles west of Blacksburg, a little town called Pembroke, Virginia, in Giles County.
Okay.
14 miles from the West Virginia state line. Country girl.
Okay. All right, but she's a Richmond girl, because as you heard in the introduction, she's been a ram in Charlottesville.
Right.
So we're lucky to have her in the RVA. We're very lucky for that. Now, I will tell you, I'm a true neuro girl. Cardiac just doesn't do anything for me. We always say in the neuro world that hearts, they aren't anything without us with the brains, because that makes sense. So as you see today, we have our brains right here. We have a little bit more graphics for you tonight with that. So I know you also are very much into neuro. So with that, though, I think the important part I want to say about nursing is that the sky's the limit. It's nice to have that flexibility. So were you always a neuro? Well, I know you know now you've transcended, but you love neuro.
Well, it's so interesting. I, again, had a great experience. Roanoke Memorial School of Nursing out in southwestern Virginia, way back when, before it became affiliated with Radford. It was a diploma school. Had a fantastic experience working in what then, in those days, and that's been almost 40 years, was a neuroscience focused intensive care unit. That wasn't heard of in some other places. Mm-hmm. I came to Richmond to complete my bachelor's of nursing degree at VCU, and happened upon a job in the neuroscience unit, and I fell in love with it. I fell in love with it. I think I'm a lifelong learner, and one of the magnificent things about neuro is that you can't learn it all, and it's sort of almost the last frontier, if you will, in medicine Maybe I'm wrong about that, but I feel that way. And it's the last frontier, and there's so much to learn. And so I started part-time. I was going to school, trying to finish my degree, and fell passionately in love with it. And here I am 37 years later in neuro, and I still love it.
And, I'll say I have a similar story in that neuro was actually my first. And I loved it because you're right. I mean, we are, and I like being the last frontier. We have a lot of things in neuro that we're just learning. And I think that's the important thing in healthcare. And one of the things that we wanted you all to know in this segment is don't think that the way that we took care of the brain and the systems for example, I'm going to always say stroke and Alzheimer's disease and Parkinson's, the way that we took care of things back then is very different than we have now. We are really studying the brain, which is really why we have the brains here. So Sherry can kind of teach us a little bit about that as well. So we are here tonight to talk about neuroscience. Now, what got you into the oncology piece in brain tumor?
So interesting. I, again, passion and love for neuro, but then along my career path, I developed this passion for brain tumor patients. And I really don't have the answer to how that happened, just that I felt like that was an underserved group of patients between the combination of the oncology and the neuro. And it has such an impact on the quality of life of patients. And so my passion started to develop as I worked in a clinic at Virginia Commonwealth University with those kinds of patients. And my passion just grew sort of with 1 foot in neuro and 1 foot in oncology, because so many of these brain tumors that patients have, actually the largest number of brain tumor patients are metastatic brain tumors that mets from the breast, the lung, and many other organs, but those two in particular. And so my foot just sort of got into both. I think my compassion and my drive to serve just was a match for both of those things, and so it pulled them both together in my career.
Yeah. So I think that's important too. Anybody in healthcare, it is not easy work. So you have to have something that you're passionate about.
That's right.
I mean, I think that's the one thing that keeps that spark really going. And I know, as I introduced Dr. Fox, she is the VP of Oncology for all of Secours. And so there are other entities, and as I was doing some of my research, brain tumors actually is a small part of the cancers. I mean, when you think about cancer, everybody always thinks about breast cancer, now prostate cancer, and lung cancer, etc. But the brain tumor, and that's why I say with that neuro piece is very, very intricate, and it's very small, but it can be very devastating.
Right.
So that's what I wanted to talk a little bit about. And you talked about a little bit about the largest comes from so metastatic from somewhere else. But for people to understand how brain tumors are, I think you have to understand the brain, and I'm glad you were a professor at UVA so we can take the time to really understand that where things happen in the brain is very important to us in neuro in what happens next.
Right.
So tell us a little bit about that, using the model and what would have happened and how you would teach people just about the basic A&P of what you're looking for in the discussion, because I think people don't understand the brain at all.
Right. So, wow, tough question. So the brain, all of our organs are certainly critical and intricate to daily life. Our heartbeat, we have to have that heart to pump the blood to the brain, our kidneys that filter everything out of our bodies. Every organ is critical. But the brain is somewhat unique, because the brain is the organ that makes us who we are. And it gives us our personality. It regulates all of our bodily functions, and we don't often think about that because it's not something we have to process or think about. There are intricate parts of the brain that make our heart beat, make us take a breath when we're sleeping. There's nothing about us that the brain doesn't control, which is what makes it such a fascinating organ. And I don't know if the analogy is right to compare it to a computer, but we feed all this information from our bodies into this central processing organ, and the brain is programmed divinely to put out information that helps us live. Again, helps us take a breath without us knowing it. When we're sleeping, helps regulate our kidneys, helps regulate our heart, our personalities, who we are. There's just nothing that the brain doesn't control, and thus my fascination with it. And again, we don't completely understand everything about that new frontier, but it's integral to physical life, which is taking a breath, again, regulation of kidneys, regulation of the heart, but it's also integral to our emotions, our reactions to our environment, all those kinds of things.
Mm-hmm. Yeah, and so I think that's important for people to really understand. We also talk about in these series, if you're not feeling right, it's not just where you're having those ailments. Something in your brain is triggering that you're not right. And so that's why we'll talk about some of the tests and diagnostics that need to be done. But in regards to if you're not feeling right, you need to make sure that you go and get checked out, because your brain actually is signaling something is wrong. And we talk about, when we talk about neuroscience, is your brain being the center of attention, but also your spine. And we'll talk about that next week, as being like a telephone pole where you have your neurons and firing that out. So we'll talk about that next week when we talk about spine. But again, we're going to talk about the brain tumors. And actually, let's talk about, we know that, of course, the brain tumors, when you are thinking that something is wrong, what are some of the signs and symptoms that you may see if you're having a brain tumor? And we'll talk about if there's a primary brain tumor versus when there's something secondary, which means it's somewhere else and it comes from something else.
Okay, so let's separate kind of those two things. So the first thing to say is, so that we don't panic over this, brain tumors are rare. About only 2% of all cancers are brain tumors. So odds are that if you're experiencing unusual neurologic symptoms, that it's not a brain tumor. It's something else. But with that said, one shouldn't ignore symptoms that are plaguing you. So some of the more common symptoms, and it's often nebulous. It's not hard. It's not easy to narrow in on. But some of the symptoms are changes in mentation. In other words, changes in memory. Can't remember what you ate for breakfast. Can't remember where you're going. And usually the memory and the mentation changes are significant. All of us, as we age, and gee whiz, I have way too much experience with this. As we age, we forget little important details. But significant things are losing your way to a common place that you've gone before. Or it just escalates. to a higher level. So changes in mentation. A second possible symptom is seizures, and about 50%, I believe, is the correct number of patients who have a brain tumor may present with a seizure. And the knowledge in neuro is if somebody over the age of 18 presents with a seizure, it's a brain tumor until it's ruled otherwise. So it could be a mass, it could be some other things. So changes in mentation, seizures, and then again, physical ailments that are related to the brain, changes in speech, inability to articulate certain words, physical impairment of the arm or the leg. Again, the symptoms almost mimic stroke. They do mimic stroke. So one doesn't know. So if you are experiencing a change in the way you're thinking, if you are experiencing a change in your physical ability to use your arm or your leg, if you are experiencing an inability to speak or to articulate words, those are very prominent symptoms that should be explored. Doesn't mean it's a brain tumor, but it could be. It could also be a stroke. It could also be other neurologic complications.
And the one thing I always like to say in reference to the brain is it's a certain size. I mean, it's not made to grow.
That's
so
right.
When you think about a tumor or anything, that means that's a space or that's a mass that is adding. And so the brain is tight.
Right.
Which you see in these models.
Right.
There is no room for you to have any excess or growth.
And this model would demonstrate that the best. This model is a little bit oversized. The brain is about between 3 to 5 pounds in humans. Varies differently, again, among individuals. But you can see perhaps from the model how tightly enclosed this might be and how the skull would enclose over this. So anything, a tumor, blood, pus, infection, anything that would encase this area would cause pressure that would be abnormal. So your point, Pat, is well taken, and thus the reason that patients experience the symptoms that they do with a brain tumor.
Mm-hmm. And so when we talked about our other shows in the brain with stroke and with seizures, the reason why you're having those problems is, again, it's got to find some room for that tumor to grow.
Right.
And so it pushes on other areas of that. So we always ask folks, is there any way that we can stay at low risk for having a brain tumor? I mean, I know people want to know, and I'm not sure if there really is any way for that, but I know inquiring minds would love to know.
Right. It's a common question, a difficult question. There is not a lot of research that indicates causes of brain tumors, despite the popular theme that cell phones and those kinds of things cause brain tumors. There's absolutely no evidence, none, if you're looking purely at the literature, that the use of a cell phone would cause a brain tumor. There are some studies that suggest that exposure to propellants, gasoline, mercury, toxic chemicals that you may have worked with your hands could have a relationship. It's difficult, again, to draw that analogy. Probably the best advice is to avoid all those things that we talk about with cancer in general, which is don't smoke, don't drink, good nutrition. There have been some questions about trauma to the brain, head injury, and whether there's an association between head injury and brain tumors. And again, the research is not conclusive. So to the prevention and the protective aspect, protecting our heads, having our children wear helmets when they cycle, all those kinds of things is not just a prevention for potentially brain tumors, but any kind of neurologic injury. Any kind of neurologic injury can change your life forever. And so it just doesn't relate to brain tumors. But again, I just want to repeat very carefully, there's the evidence out there in the literature doesn't suggest that any of these are direct causes of brain tumors.
What about family history? Any linkage there at all?
There are some rare cases of family history. Interestingly, again, cancer runs in families, as we well know.
Okay.
Brain cancer, because it's rare, we don't see a lot of examples of that. In my almost 40-year career, I've only ever seen one family where I saw a son and a mother have a highly malignant brain tumor. Again, there's examples out there, but they're pretty rare. So I guess the takeaway message is that if cancer runs in your family, you want to pay attention, but not so much brain tumors.
And I think we're always going to say, I think everybody should know your baseline. You should definitely know how you're feeling. You should go to the doctor at least once a year. I said age 30. I mean, there's certain things you should do, males, females, for that, just to know what's going on and know your family history for other things. So let's talk about that. I have some symptoms, or I'm not feeling quite right. You talked about the mentation was a big thing. I noticed that I'm having maybe some balance problems. I'm not feeling well. Who's the first doc I should go to?
Well, first of all, let me take a step back too,
Okay.
because one of the things I didn't mention is headaches. I talked about seizures. I talked about change in mentation. Sometimes the person experiencing doesn't notice the change in their mental capability. I also wanted to mention headaches. The headaches that come with brain tumors are pretty classic, and they're usually headaches that wake you up in the morning. When you're lying in an incumbent position, that increases the pressure in the head. When you sit up or stand up, that changes that pressure, so the headache gets better. So I wanted to mention that. First doctor you go to, check in with your family doctor as a first line of treatment. A second, if that's not satisfactory, and whatever symptom you're having, whether it be mentation, seizures, headache, change in physical functioning, a neurologist is probably your next line of defense, in terms of identification of what's going on. One of the things I've learned in my long career is that sometimes, because brain tumors are so rare, sometimes symptoms get written off as stress or something else. And if those symptoms persist, you should pursue that with your family doctor. Family physicians, fantastic. But if something's still bothering you and it's not getting better, don't give up on that. Keep pursuing it until you get an answer, would be my advice. Again, family physician first, neurologist second. Until you know you have a tumor, a neurosurgeon, certainly our neurosurgeons are wonderful resources, but probably those two are the first to to start with,
Okay.
depending on your signs and symptoms.
And then that's what I was, and so what are the likely, what are they going to do for, what type of tests or labs are out there for someone possible thinking about a brain tumor? And you're really probably ruling out a lot of things.
Right.
What should somebody expect?
There's not really any lab per se that would diagnose a brain tumor, but imaging is certainly important. A CT scan would be the first line of defense to identify if there's anything in the brain, whether it be a tumor, a blood, anything like that. So CT scan, first line, would be something you could expect. If you potentially have had seizures without that imaging, an EEG, electroencephalogram to determine the electrical activity of the brain might be important. On a higher level, let's say, for instance, they do a CT scan and they see something that looks suspicious. The next level would be MRI to determine, because an MRI has a higher level of sophistication. Another test might be an angiography or an angiogram. Again, these would be higher level things once one saw some kind of mass in the brain. So, but preliminarily, again, an EEG, a CT scan, there really isn't particular blood work that would suggest that one had a brain tumor.
So all of the diagnostic tests are really on the outside. That looking at the X-ray of your head, and the EEG is going to look in the areas really of what's going on there. And so that's where I would say you probably bring your neurologist in to be able to do that.
Right.
That's who you be your first line.
Right.
You're going to get ready.
I think it's another important thought. Suspicion of a brain tumor. Again, brain tumors are rare. So the first line, when you go to your primary care physician, that's not going to be what they're going to be looking for, right? And so, and it is a rule out diagnosis. But as a caveat to that, if you have cancer in your lung or your breast or anywhere in your body, but particularly in your lung and your breast, and you start to develop neurologic symptoms, which might be change in mentation, change in speech, change in your physical ability to use your arm or your leg, then that would create a higher suspicion of a metastatic brain tumor.
Okay.
And would be much more useful, if you will.
Okay. So let me, there are a couple of things that you said I wanted to make sure we hit. So we've talked about going to a neurology, and then we're talking about at this point that you don't know, and it's primary. If you already have a type of cancer, you should be or would you have an oncologist at that time?
Well, I think it depends on it depends on where you are in your treatment scheme.
Okay.
You likely, if you have had cancer, any history of cancer, you've got an oncologist, because the standard of care is for surveillance even beyond your treatment.
Okay.
Even if your last scan looks like everything is clean and you don't have any cancer, you still have to be alert to the fact that it can come back. It can come back in different places, particularly the brain. And so your oncologist in that situation would be your likely source of direct contact first.
Okay.
Before you contacted a neurologist or your PCP. Your PCP potentially, depending on how active they are in the management of your cancer, but definitely your oncologist if you've been treated for cancer and are continuing active surveillance.
And we'll be happy to take, I just thought about that, take phone calls, and I think the number will be up. It's 918-521-5202, and we'll be happy to take any calls that come in. So we talked about some diagnostics, who you might be able to see, the physician-wise. I mean, to me, anything that when something goes wrong, particularly with any type of diagnosis, is overwhelming. So I wanna, before I forget, I mean, I said we're talking and it's moving by fast. The color quality of life, because support systems are needed. I mean, this is overwhelming. So let's talk about that a little bit before we even go any further, because I think that is a hidden treasure in the RVA. It's very special. And so I want the community to really know more about the Cullether Center.
Well, and thank you so much for asking. The Cullether Brain Tumor Quality of Life Center is a very unique center, started by a family who lost their son and their wife to the worst brain tumor that exists, which is a glioblastoma multiforme. And they wanted to create a resource center where people could get their questions answered, etc. And so that center exists for the last 8 years at St. Mary's Hospital, and it's in the MOB South, Suite 108. And what is there's so many things that are incredibly unique about us. Number one, there is no such thing as a brain tumor quality of life center anywhere in the country. In all my national work, I've never seen another center like what we run at St. Mary's. Number two, we serve all patients. We do not care where you are getting your treatment. We have several wonderful healthcare facilities in Richmond, including VCU, HCA, and Bon Secours system. And it doesn't matter to us where you get your treatment. We are available to you to provide education, what I call anticipatory guidance, which is, kind of what can I expect? What should I think about next? We provide free yoga, free art therapy, free music therapy, massage therapy, everything, counseling, everything we do is complimentary. And again, doesn't matter to us where you get treated. We want to offer our services to you because, as Pat said, the diagnosis of a brain tumor is catastrophic. Hearing the word cancer is catastrophic. Hearing the word brain tumor is beyond catastrophic because it changes the person's personality, who they are, their ability to work, their ability to continue their roles in their family. There are cancers that can do that, but most of the time people can carry out their roles, they maintain their mentation. Brain tumors are different. So the Cullether Center is very unique. And so all you need to do is give us a call. You don't need a physician referral. We don't deal with insurance. You don't get charged for anything. And we're there to provide help, support, guidance, and a lot of special activities that you can't get elsewhere in the community without payment.
And that's why I said it's definitely a hidden treasure to hear something. One, you don't have to have insurance to come there. The second thing that I think is unbelievable is that it doesn't matter where you're getting treated for your cancer. Here's the support there for you and your family, correct? And your family.
Absolutely.
To help you get through this catastrophic event and be able to have that support and resources in various ways. So I know on Bon Secours, you can go on our website and certainly look up cancer in the Cullether Center and see that. But the resources of education, of what can I do, of how can my family be there. We also now have a place where the Reinhardt Center, if you have family coming in and you're getting treatment, we can talk about that as well. But it's just incredible to be able to have that
Right.
For anyone in the United States.
Right. I have patients, I have about, over the last 8 years, we've served almost 800, between 800 and 900 patients. Right now, I have about 400 and some patients. Patients from all over the country. If you can't come to us, we come to you via phone connection so that you're not alone. We have written materials, booklets. There's no, our counseling services can be done over the phone. And again, it just takes a phone call.
Unbelievable. So please look at that, the Colother Center. It's there 24/7 in reference to being able to get in touch with somebody, and they will get back to you. So we're talking about brain tumors tonight, another side of neuroscience in the brain and oncology. And now that somebody, and we're trying to go through the transition period, I've just found out that I do have a brain tumor. What happens next? In reference, we've had the diagnostics done. I now know that I have a tumor. What happens, and what do? They try to take it out, or what are they looking? What happens?
The majority of the time, there's a surgical approach. The standard of care would be surgery to remove as much of the tumor as possible without doing any kind of damage to the person's neurologic system. Number two would be a combination of radiation and chemotherapy. Typically, if it is a more malignant tumor, again, all these things depend on whether you're dealing with a lower grade versus a higher grade tumor. Higher grade tumors, again, would be surgery, radiation, chemotherapy. Lower grade tumors are often watch and wait. And so they're sort of it depends. It's not like it is somewhat like other cancers in terms of the approach. So it's all dependent on the where the tumor is, the size of the tumor, and what that tumor turns out to be. Neurosurgery, I'm not a neurosurgeon, so I can't testify to that in terms of that, but I have enough experience that neurosurgeons' approach is to get as much tumor as possible without damaging any part of the brain so that the person maintains their utmost quality of life. In addition to trying to get out all the tumor they can. And then hopefully the radiation and the chemotherapy then attack what might have been left.
So that's truly, you have to have a team approach. And that's another reason why I would say something about the Colother Center and helping it to navigate, because that's a lot of people you're talking about. The hospital team, anesthesia, you may have to have some rehab depending on where again that is. It may also change your personality. We talked about that as well. And one thing I always think about with cancer is the treatments of radiation and chemo. How is that going to affect you nutritionally with those types of side effects, and what does it do?
So that's an absolutely great point. We do have a multidisciplinary approach. The Colother Center, although we are not physician-driven, we work very closely with the physicians in our community, including our neurosurgeons. And I'm sorry, Dr. Alexander couldn't be with us tonight, and our neurologists, our radiation oncologists, our medical oncologists. And so we very much have a team approach. One of the first questions patients often ask me is about nutrition. There's sort of this sort of common, how long have I had this? How did I get it? Can I get rid of it? And how can I eat and live better so that it will go away? That's kind of the common scenario of questions. And so we do have access to nutritionists. We have access to psychologists, psychiatrists, navigators who, hold your hand and say, this is what happens next. Let's call this next physician and get you in. Mm-hmm. Let's call the nutritionist and get you in. So that navigator is very critical in terms of getting through this scary and catastrophic time in your life.
Great. So callers, the number is on the screen, and it's 915-5202. We will take calls at any time. So I know it can be really frustrating. What other thing? I mean, there's so much going on as we talked about the team approach. Key questions before going into surgery or deciding that of what next steps to do. The Colother Center will help with that, I'm sure. But what are there any key questions that you think are very important that someone should ask or be prepared for?
There's actually so many, and some depend again on whether this is a low-grade tumor or a high-grade tumor. So you kind of have to gauge that.
Let's wait for hold that thought. Hi, caller. You're on the air. Thanks for calling.
Hi. I was wondering, what can the family members do, or I guess what resources are available for family members as well that are supporting a patient with a brain tumor, or I guess in helping them manage their care, but also in helping them manage being a caregiver?
That's an absolutely fantastic question.
Thank you, caller.
One of the things that the Colother Center does is, in addition to serving the patient, we serve the family. So all of our resources, including our counselors and our massage therapists, the yoga, art therapy, is all open to the caregivers. In Richmond, we are blessed. We have a brain tumor support group that's been in existence for somewhere around 15 years. And that support group, it's the only brain tumor support group in Richmond. And so we're very, very lucky to have that. Seeking any kind of caregiver support networks, there's a lot of things online. Caregiver support groups. Oftentimes it's difficult for caregivers to get out and about with somebody who has neurologic impairment. And so they often have to use online and phone resources. And so those are very, very important. So again, the Colother Center, there's a brain tumor support group. There's multiple cancer support groups if a patient finds that useful. I often have brain tumor patients tell me that they and families, that hasn't necessarily met their needs, but it's there. There are mental health resources, psychiatrists, psychologists, church, spiritual resources. We don't want to forget that. So, and particularly in the Secours system, chaplain services, bereavement services, etc. So there is many resources in Richmond for brain tumor patients. It's a matter of reaching out and connecting to those.
And I also think it's important that at the Colother Center, they certainly will individualize it. I mean, I think that is the one thing that also makes it very unique, is that they're sitting down with you. What is important for you, what's important to the family, the quality of life, because again, it's catastrophic for the entire family to be able to go through this as well.
Right.
So typically after they, of course, this is something that would have to be handled in the hospital. Having that surgery, is ever seen outpatient surgery with this?
Actually,
or are they getting late? I mean, I'm really old school now with what's going on.
Again, it depends on. Interestingly, most brain tumors are inpatient surgeries, but now we have the blessing of having stereotactic radiosurgery, which is it isn't a surgery by knife. but it's called stereotactic radiosurgery, and that's an outpatient procedure.
Wow.
And so many years ago, when I was a very young nurse, back in the late 70s, we didn't have this. And so there were tumors that would pop up in delicate places in the brain, deep inside the brain, in the brain stem, where we couldn't do the surgery. And once stereotactic radiosurgery came along, which is a procedure where they used a computerized program to target high-dose radiation to the tumor site, that tumor can then be potentially shrunk and potentially even disappear.
Wow.
So it's not surgery as we mostly understand it, but again, it's called stereotactic radiosurgery, and that's an outpatient procedure. So the patient can go in and have that procedure and go home the same evening with minimal side effects.
Wow. And I will have to say, when we talked about me being a neuro girl, when I was going through my clinical rotation, what got me interested in neuro, you always have to go in the OR, and it was a craniotomy, a neurosurgery that I saw, and I was like, this is unbelievable, fascinating, and just the art of the neurosurgeon. Now, see, Dr. Alexander, I'm giving them credit about their art and how they do surgery, and he's not around, but I thought it was so fascinating to be able to do that and to help somebody to get back and to remove that at that time, and then just watching the ICU nurses and what they had to do for recovery.
Right.
So what else about the Cauliflower Center? I know that for oncology, there are so many community outreach programs and so many events that you all have within oncology. Are there special things that are being done for fundraisers for the Cauliflower Center? Because
yes.
I know this is a lot. You said 800 folks, and they don't have to pay. I mean, I know there's some support things.
There are, and we've been very blessed in the Cauliflower Center to have tremendous support from our philanthropist and his extended family. In the 8 years that we've been open, we've raised $1.6 million.
Wow.
In funds, and so there's several events. It's so wonderful. We have these big events. One of our big fundraisers is the Celtic Festival, which Loveland Distributing, and I want to say a shout out to Loveland and to Mark Stepanian and his family, because they organize these fundraisers every year. And the Celtic Festival is a huge support. Cauliflower Center receives a significant amount of funding from that event. But the other thing that is so touching is we get memorial gifts from our families because our support means so much to them. People just do the most interesting and fascinating things. We have children who raise funds. We just had a young lady who lost her father. She's 6 years old, and her father died in April of a malignant brain tumor. And for her birthday, she asked all of her friends to bring a donation for the Cauliflower Center instead of gifts.
Oh, wow.
So those are some of the kinds of things that happen for us that help us raise funds. So memorial gifts, fundraisers. We have some other more formalized events, but we've been blessed. And what's really important to me, one of the things I look at as a donor is how much money it goes toward administrative costs versus patient services. And for Cauliflower Center, 90 to 95% of all donations go directly to patient services. There's no overhead. Thankfully, to Bon Secours. Bon Secours is very gracious in helping provide some salaries and some support for written materials, etc. But all of the money that we raise predominantly goes to patient service, so that's very important.
It definitely is. And that's amazing to me, a 6-year-old giving back. But I think the important part is while her father was around, the support that she received and that comfort level of helping, I think is exactly goes to the core of what our mission is, giving that good help and service to those in need.
All right.
So we have a few minutes left before we go, and I just wanted to emphasize some things and definitely let Dr. Fox emphasize things that, we're talking about a neuroscience series. However, branching out into oncology and brain tumors and understand how they cross, and so you get that support in that specialty area. I also want to emphasize that brain tumors are only about 2%. So I don't want everybody thinking they have a headache tonight, oh my God, I have a brain tumor, particularly if you don't have cancer in your family or don't have cancer anywhere else. So don't start to think that, but we wanted to, again, enhance your education. So is there anything you want to say, Dr. Fox, to the audience, just to reiterate what's important besides the things that we have said that you want them to remember or to share?
I think I would just re-emphasize what you just said. It's a little scary that thought of this, that this could happen to you. The odds are slim. Again, the symptoms are sort of classic. It's a headache that wakes you up in the morning while you're lying flat. It gets better when you get up. Seizure is classic. It's very hard to define the symptoms, but for family members, don't write off changes in mentation. This has been an experience of mine over my 40-year career in neuro, is people often look back and go, well, Uncle Joe was acting kind of weird, but I thought it was just because he was old. So don't write off those kinds of things, but also don't go out there and panic that you have a brain tumor. But if you do know someone, either in your family or in the community, that has a brain tumor, please mention the Cullither Brain Tumor Quality of Life Center to them. We do not spend any of our hard-raised dollars on advertising, so you won't see billboards and printed flyers and commercials, etc. But if you know someone, we would love to serve them. So please look us up and let us bring you good help in a time of need.
Thank you, Dr. Fox. I think, again, in all our series, we want you to know that we are certainly here to help you. We have resources throughout for neuroscience, and now you've heard Dr. Fox talk about brain tumors and certainly oncology as well. We have all services within Bond Secours to be able to help folks. A key is, if something doesn't feel right to you, do not go back to bed. Do not lay down. Make sure that you know what your baseline is and just say something's not right. It's not anything wrong with saying I need to go to my primary care physician and to get things checked out. We talked about physicians tonight. If you're not satisfied with that, let us know. So I certainly want to thank Dr. Fox for being here. Next week is our last show. So until next week, have a happy, safe Neuro Week, and I look forward to seeing you next week. Thank you.
Good questions, girlfriend.